I'm Dr. Chris Cormier, founder of the Neurofelt Health Institute, founder of Body Chargers, and I want to talk to you today about sleep apnea and basically snoring, conditions where you're not getting enough air, especially when you sleep. So our bodies, we have 30 trillion cells, roughly. Those 30 trillion cells have ingredients that make them up. And the number one ingredient in all those cells should be oxygen gas. And we know this through science. You can do without a lot of things, but you cannot do without breathing. You can do without drinking water for a few days. You can do without other things, food maybe. You cannot do without breathing. And that's because this air we're breathing has about 21% oxygen, and it's feeding oxygen in your cells, and your body needs to maintain in each cell about 65% oxygen. Unfortunately, the world we're in right now, there's no telling what's in the air we're breathing down here. And I guess it goes for the country. It maybe goes for a lot of parts of the world. But in the rural type areas, maybe the air you think is good might be surrounded with pesticides. So the air quality, number one, is a problem. We're not breathing good, clean oxygen. Another problem is the amount of oxygen in the air used to be higher. If you look at history, it used to be much higher. And over time, it's coming down. And then you factor, we're in a worried world a lot. We don't breathe enough. So we're not getting enough oxygen to our cells. If you compound that with snoring, then you really don't get enough oxygen to your cells. You compound that with a deviated septum, you really don't get enough oxygen to your cells. And so then your body's number one ingredient gets low and you start to develop conditions. And keep in mind, oxygen in your cells, it detoxes things. It gets rid of toxins. So the better the amount of oxygen in each cell, the less toxins you develop. I want you to think about now, especially in the United States, sleep apnea and sleep apnea devices and snoring devices. There are so many of them out there. It's millions of people that are suffering with these types of conditions, and it's ever growing. It's getting worse and worse and worse. And those conditions can lead to cardiovascular conditions. It can lead to other strokes. It can lead to diabetes and autoimmune conditions just on the basis of you're not getting that number one ingredient into your cell. So I always like to give you examples of how I've gotten to the point of where I've gotten to clinically and what I had to go through to make discoveries to be able to help you. And oftentimes it happens in my family. So my son, who's now 20 years old, he plays college football. When he was around 11 years old, he was climbing a fence and fell off the fence and hit his nose. And he runs inside, he's bleeding. And so we did our best to help him at that point, but there was a little bit of crookedness to his septum, just a little bit. And then he kept growing. He had massive growth spurts. And so it led to a crooked septum. Then it led to airway issues where he had trouble breathing. And you can imagine being a college level football player, there's a lot of exertion that happens. And so I tried everything that we have here, all the different techniques and everything we have, and really nothing was helping that deviated septum. So I started to think like surgery. And for me to think surgery, it's gotta be pretty bad. And so luckily I was able to talk to one of my colleagues in California just as a last resort. I'm like, is there anything you know of that would help, with this deviated septum? And he said, absolutely. He said, I have a doctor here that's trained in this technique, and he gets people from all over the world to come in, get it done. And essentially what it does is it literally just opens up the airway here and on either side. And so I was like, well, that's cool. So I actually went and got the training for it. I'm the only doctor in the state of Louisiana doing this particular technique. It's called cranial facial release. And what it is this actual balloon. And so you're able to take this balloon, and you can imagine this is a nose here. So imagine this is just one nostril, And when you breathe in, there should be a big opening or openings here that lead to the back of your throat. And so over time, what ends up happening to people is, this whole airway area here gets smaller and smaller and smaller. And so when we put a balloon up there and we blow it up here, it actually opens this area up. Inside of your skull, there's 22 different bones that fit together. So any trauma you've ever had, my son falling off the fence, bumping the head in any kind of direction, it can actually knock some of the joints in those areas out of whack where they can't open and close like you should. And then the next thing you know, you're not breathing properly. And I want you to imagine when you're breathing in through your nose, that oxygen's really helping to get up into your brain and going into your lungs everywhere. It's like getting into that whole airway. Your nose filters your air also more so than your mouth does. So whenever these nose nostrils here are opened, they're able to get more oxygen into your system. We're able to expand those 22 bones and make sure that they don't have areas where they're kind of restricted. They just need to be opened up. And so this technique called cranial facial release in combination with our other therapies to help restore oxygen is just fantastic for helping to reverse all the different conditions associated with not getting enough oxygen into your body, whether it's just from a deviated septum, whether it's just from sleep apnea, or breathing out of your mouth, not breathing through your nose. Not only do we have the ability to do that here, but we do that in tandem with other oxygen therapies to help restore the oxygen to cells. So if you're looking for a solution that does not involve drugs, injections, surgeries to help with your sleep apnea, your deviated septum, at the Nerve Health Institute, we're the place you should go to help breathe easier and get that number one ingredient, oxygen gas, back into all your 30 trillion cells.